So, you know what Dr. Dar does. I have it well described in that video about Dr. Dar defrauding Medicare and harming patients. So, apart from the physical exam and all that, when it finally comes to the records, she just puts a whole bunch of crap in the records. Now, she doesn't put any of the history I gave her. And how can she not know the history? I gave her the history, a summed up version. And that history has been all over the place. It's in court. I have it written out. I had it sent to medical board or whatever. So, you know, it's been all. So she can't deny that I didn't give her the history. So we know what the history is. I even gave it summed up. And none of my history shows up. And I actually gave it fairly. Now, my history was summed up, you know, until I got to Inova. The Inova doctor actually did a really good job of summing up my history to date, you know, until that date. The only addition was there was this issue where when my symptoms transformed in 2003 from like migraine symptoms into some different like numbness and dizziness and drowsiness in the head. When my symptoms transformed at that time, it came right after taking Tegretol, and the neurologist that time acknowledged that, you know, I had a cardiotoxic problem show up after taking Tegretol. So only that portion was left out, that in fact my symptoms transformed and turned into some kind of a heart condition. But even that, and that's because after taking Tegretol. So, you know, whether or not it was the Tegretol by itself or the other injuries which were there before, you know, caused the Tegretol to cause the problem, whatever. But more or less, you can say until, and then, you know, the original injury, I showed a report from Johns Hopkins showing their ENT department you know, they kept showing a S-shaped deviated nasal septum, and that's supposed to be a really bad thing. The S-shaped, you know, a deviated nasal septum, it's commonly found, but when you have an S shape, it only comes from the most violent injuries. So I did have a very severe injury, and you know, the symptoms came after that, and then it transformed with the Tegretol. Anyway, so I got to that stage. Now what she does is she completely lies all over the record. She makes the presentation that you know, she doesn't put any of my history. She doesn't put that I gave her. She doesn't put any of my records, but she lies all throughout. So the neurologist, so what she says is, I've had extensive neurological evaluations. That's not true, because my problem was so old, and really I hardly had any neurological evaluation. In fact, anyone looks at it, what they say is, why the hell haven't I been to the doctor? Because really from 2004 until 2013, I didn't even seek any treatment because the condition was so stable. So, you know, so she tries to portray me as though some kind of a hypochondriac, because you know what neurological symptoms are. Yeah, if you have a variety, she writes down he has a variety of neurological symptoms. If you have a variety, that means you're crazy. Either you're imagining it or you're making it up, okay? You know, either you're crazy or you're a liar. So that's how she presented it, and I really had just a small number of, originally it was a migraine, and then after that numbness, dizziness, and drowsiness. Basically they're like, you know, a version of each other. They go as a set. So there's no variety of neurological symptoms. And then she says that I've had all these extensive evaluations for this variety of neurological symptoms, which I haven't. And what she claims as evidence is, she claims, well, I had it with Dr. Barty at Johns Hopkins. No, Dr. Barty at Johns Hopkins is an ENT. The ENT department did a extensive evaluation for sinusitis, okay? And so she's making it appear as though I went to Johns Hopkins and I went through this battery of testing for neurological condition. Absolutely wrong. Then she says, so that's way back in 2000, right? And my condition started in 96, and then that's way back in 2000. And then her claim, the next one, Dr. Jaitley, the same thing. Now he's a neurologist, but he didn't do any kind of testing. Don't the records show that? All he did is a neurological physical exam. That's not called. You could call it an extensive neurological physical exam, just like you have an extensive cardiovascular physical exam by a cardiologist. It doesn't mean you had any testing after that. So what she says is, I've had all these tests and I haven't. I've just had the basic physical, more or less. And then after that point, so from 2003 we come all the way down to 2013, and then she claims that I had an extensive neurological, same garbage again. No, I did. I just had the basic MRI test, and that I didn't even want that MRI test, and I only took it just to get treatment from the neurologist. Yeah, I was like, you do a neurological exam, and if nothing shows up, just go ahead and treat for symptoms. That pretty much is what the Neurology Academy or whatever nonsense they say. Whatever they say. Now, we know all the neurologists like to make a lot of money, so they go ahead and sign people up for all this tests. But we know that you go to a neurological exam with a neurologist, and you have the symptoms for a while. Yeah, there's no need to do anything more. You just kind of start. So anyway, I just did the test just to make the doctor happy there, basically. So, and that was it. That's just a basic MRI, which all neurologists order up anyway. So she makes this presentation, I'm this kind of a hypochondriac kind. But if you look at that neurologist, didn't indicate any kind of psychological condition. In fact, even there was like a psychological test, which is called a neuropsych evaluation, which includes a psychologist, I guess, a psychological workup, but that neurologist was so confident I didn't have any kind of psychological problems that she actually erased. She actually said neuropsychological exam limited to attention and concentration. That's it. So there wasn't any issue of any kind of psychiatric condition where I'm just sensing or feeling neurological conditions that aren't there. It's nothing. Obviously, I didn't get any treatment for 10 years. So how do you position me in that way? So this damn Dr. Dar, she just, when that fucking bitch Dr. Dar did that, what it means is when the next doctor sees that, or, they don't believe what I say, it's like a crying wolf kind of thing, because this fucking bitch lied about what I said, and she, that's not what I said. Obviously, that's not. So why didn't Dr. Dar just say what I said? So instead of saying what I said, she uses words like variety to miscast me. So and then what I said is she went and put all these garbage diagnoses on my list. So she's got like a whole bunch of diagnoses which make it look like as though I'm at a high risk for a heart attack from being a fat slob. When that fucking bitch Dr. Dar knew right away that I'm not a fat slob and I only have some edema, and she knows that my calcium score is 0. So obviously, how can she present me in this way? And so what she picks up on is there's this blood test which shows my, I guess, not even my main glucose, my hemoglobin A1C was a little was not even over the limit. No, it was just on the high side of normal. But Dr. Dar, the fucking bitch, she knows that since, my heart condition, where the blood completely disappears from my heart, so when that happens, which I told her, I told Dr. Dar that, when I have those problems, I go ahead and eat some cookies or something, and that makes sense, If your heart completely is drained of blood, yeah, it's good to eat some cookies, so that'll keep you going. So I guess that, makes that hemoglobin A1C a little bit high. But that's a very temporary condition because otherwise I'd be dead if I didn't eat those cookies, you fucking bitch. And obviously I don't have that problem. So you're just lying, right? I mean, I don't have any sugar problem. I don't even eat cookies and stuff normally. I told Dr. Dar I eat a very good diet. Obviously, Dr. Dar, my arteries are pristine. There's no 43-year-old man or 44-year-old man with pristine arteries. Okay? That's because I have a really good diet. And it's really my conditioning and my fitness that's actually helped me survive all this harm that these asshole doctors are causing. So really, her trying to present me, so she puts all this garbage diagnosis on. She says hyperlipidemia. That's like no, but I think my LDL may have been slightly higher than normal, but you know what, Dr. Dar, they do the ratio, and my ratio was fine. Then she goes, obesity unspecified. And I pointed out to Dr. Dar, Dr. Dar, your employee, your medical assistant thought that I weighed 160. And when I got on the scale, it was a surprise it came back as 205. That's edema, Dr. Dar, because if you were that overweight, a person who takes people's weight every day, all the hundreds of times, should know what a person weighs. So she puts all this garbage on my record. And then what's the worst thing was, when I requested, while that was going on, I requested my records from I didn't request I requested Dr. Dar to get my records from the other doctors, and she never did. And and those doctors were concealing the records, and somehow I struggled hard and I got some of the records. And even those records, which showed like the stenosis of the subclavian artery and the axillary artery and the ulnar artery. Now, all those things were reported on those reports, and Dr. Dar never included it anywhere in her records. And so when I was telling, she said, so really, what I found out from my primary care now, which I already knew before, that when a doctor calls for records, the records are just faxed over right away. So Dr. Dar just had to request the records herself, and even 7 weeks before when I made the appointment, I filled out the form to have the records sent to that office. So my records should have been there. But Dr. Dar never got my records, and then Dr. Dar so she knew exactly what I was saying. I need my records from those other doctors. So then she sends me over to Vicky, who is in charge of records at Dr. Dar's office. But that has nothing to do with getting somebody else's records. Well, finally, because Dr. Dar did that, I just said, hey, I'm dealing with Vicky anyway here on records. Let me get the records from Dr. Dar. Then Vicky's the immediate reaction is she doesn't want to give me the records. She goes, but she doesn't say no, but she says, hey, it's whatever you discuss with the doctor. That's all that's in the records. Well, let's see. So when I got the records, no, nothing I discussed with the doctors in the records, and a whole bunch of garbage is in the records to harm me, intentionally to mislead any future provider, because when I have 2 very severe cardiovascular conditions, she's putting a whole bunch of garbage and she's making it look like maybe it's a psychological problem. She's making it look like maybe it's a regular fat slob heart attack. So she's completely misrepresenting what's going on, and it's going to really get me injured and harmed down the road. And let me keep continuing to the next video.